All right, so it is my pleasure to introduce our next speaker. Theresa Yao is one of our wonderful members of our head and neck speech pathology team at Stanford. She completed her clinical doctorate at Rocky Mountain University this year, I think probably in like record time. We talked about when she was going to be finished, and then the next time we met, it was already done, and I thought it was going to be another year beyond that, so she's pretty amazing. She's the co-founder of the Bay Area Swallowing Support Group, BASS, which there are some handouts for on the rehab table for anybody interested. This is an online support group for people with swallowing impairment, which meets every other month on the second Thursday. And Theresa brings passion and commitment to every endeavor she takes on. Thrilled to have her on our team and thrilled to have her here speaking with us today. Thanks, Theresa.
Thank you, Heather, for inviting me to this symposium. This is my, I think, fourth or fifth time here, so I'm so happy to share with you something about swallowing. And as you all know, that I'm a speech pathologist here at Stanford. I'm really passionate about helping people with swallowing problems. So today I'm going to talk about managing swallowing problems in head and neck cancer. So you may think that swallowing is the natural ability that everyone have, and we don't need to learn how to swallow. But swallowing is actually a very complicated and coordinated process, starting from moving food from the mouth to the throat and all the way through the esophagus to the stomach. This process involves so many different muscles and nerves working together correctly to ensure that appropriate safety and efficiency of swallowing. So swallowing can go wrong, and swallowing difficulty is often we call it dysphagia, the D word that nobody likes, but I'm going to talk about it a lot more today. So with head and neck cancer, we know that there's a high prevalence of dysphagia in the survivors after their treatment. For example, after surgery, people may experience difficulty with chewing, and they may have drooling or feeling like food gets stuck in the mouth or throat sometimes, and often coughing and choking. And also after radiation, people may have difficulty open their mouth and dry mouth, a lot of people mentioned before, and then swelling in the area of a radiated area, and also sometimes muscle stiffness or less flexibility of the muscle movement. And also pretty frequently we hear coughing and choking with food and drink. So particularly with radiation, there can be long-term side effects or late effects from the radiation treatment. So fibrosis and neuropathy are two consequences from radiation treatment that typically can cause dysphagia. Fibrosis just means the formation of the scar tissue that usually can lead to the tissue stiffness. And then neuropathy means damage to the cranial nerve, especially in the area that you get radiation. And that can cause the neuromuscular dysfunction. And with that, people may have reduced strength, flexibility, denervation, meaning loss of the nerve supply to those muscles. And these can eventually lead to chronic dysphagia or chronic aspiration, meaning food and drink going down to the airway. And also people may have significantly reduced quality of life. And there are some signs and symptoms of dysphagia that we should looking for so we can catch them early and have appropriate management. These include coughing or choking on food or drink, we talked about earlier, and also sometimes bringing food back up, and we call that regurgitation. And sometimes it can go all the way up to the nose. And then also difficulty with chewing and difficulty with moving food from the front of the mouth to the back of the mouth or moving down to the throat. Or food gets stuck in the throat. And sometimes people also complain about drooling. And also we hear gurgly or wet voice when people are eating and drinking. So how to manage dysphagia? Well, that's the million-dollar question here, and that's why I'm presenting here today. When I was preparing for this talk, I thought maybe I could ask ChatGPT, since everyone is doing that, and I might not need to prepare for my talk if ChatGPT did that for me. So that's what I did. I asked the exact same question I want to answer: how to manage swallowing problems in head and neck cancer. And here we go. I asked the question, and then I got my answer from ChatGPT. So first of all, I saw they mentioned speech-language pathologist. The first answer, that's excellent. So that's what you need to do to manage your dysphagia. And then I kept reading it. They did have some good advice. I don't know if you can see it, but they're not enough. And there's, certainly a lot of different approaches to manage dysphagia, and then they need to be more individualized. So the conclusion is our patients still need their speech pathologists, not ChatGPT. So that's good. Anyway, so now we're going to talk about dysphagia management approaches. And there are different ways to manage our dysphagia, and typically that include 4 different types, from diagnostics to prevention to rehabilitation and maintenance or surveillance. So in order to better manage our dysphagia, we first need to find out the problem so we can treat them. And that's why we always start with assessing patients' swallowing function. And the typical diagnostic exams or tools we use are clinical swallow evaluation. Some of you probably, when you came to our clinic, you did this with us. We are in the room, and then we gave you food and drink, and we see you eat and drink, and then assess your swallowing function. And we also have tools such as the flexible endoscopic exam of swallowing. We use the camera, go through your nose to see the throat when you're eating and drinking. And that's a very common procedure we use to check people's swallowing. And also another common procedure we use is modified barium swallow study, which is the X-ray swallow study that we use to check people swallowing with barium. So depending on patients' symptoms and also the cancer treatment they received, they may need different type of tools to help us to identify the problems and causes. Sometimes they may need just one, and sometimes they may need a combination of 2 or more diagnostic tools. So that's why you need to work with your speech pathologist to determine which diagnostic tools is the best for you. So next management approach is prevention. We know that from previous research, the evidence suggests that managing dysphagia in head and neck cancer should start before the cancer treatment to achieve better functional outcome. And that may include the baseline assessment and before any treatment, and also pre-treatment education and counseling, and which is sometimes a lot of you come to us before your cancer treatment. We talk about what's the changes you're going to experience after the treatment. And these should happen before any surgery or radiation so that we can give you the education and you can ask all the questions you want. And then also another important piece is prophylactic exercises before or during your radiation or chemoradiation treatment. And that can be very helpful. Another one is to maintain oral diet during your treatment instead of just solely rely on feeding tube. Because we know that from the research, previous research, patients performing swallowing exercises before and during cancer treatment had better swallow-related outcomes. And we also know that keeping oral diet and swallowing exercises during radiation associated with positive long-term swallowing outcome. So that's why starting dysphagia prevention early is a good management approach. So after cancer treatment, we usually will shift our focus to rehabilitation. So we know that after surgery or radiation, there are sometimes significant changes in our structures, muscle, and functions, and some patients may need to use feeding tube for a longer period of time, which sometimes can lead to disuse atrophy of muscles, meaning that you lose the muscle tissues or mass. And we also know that radiation can cause fibrosis, the scarring of the tissue we mentioned before. And then also lymphedema, or the swelling we heard earlier. So these changes in the muscles and structures need additional treatment and retraining, sometimes we call that. So that's why post-operative rehabilitation can be helpful. And that include, sometimes we'll teach people maneuvers to help them to improve, control the food, or protect their airway safety, and also some exercise to restore their maximum function. And also we will do post-radiation rehabilitation, and that include managing the immediate or long-term treatment side effects. And sometimes patient may need some intensive dysphagia training program to help improve their swallowing function. And these type of intensive dysphagia rehabilitation program may include a different combination of different type of swallowing exercises, and sometimes they will have some device to help us to do the training, and I'll go over a little bit later. Okay, so the last piece of management is maintenance, or we also call it surveillance. This focuses more on the long-term consideration, such as the overall functional status and also the quality of life. We need to monitor patients' symptoms, and usually we will perform routine swallowing imaging or clinical evaluation, sometimes yearly after their treatment, or sometimes more frequently, really depending on the patient's situation. And we always encourage people to self-monitor their swallowing symptoms, those ones that I mentioned before, so that if they find they have trouble, they can get to us and we can help them manage better. And sometimes just monitoring symptom is not enough. A maintenance exercise program sometimes can be helpful to target specific swallowing or tongue or jaw muscles. And we usually don't do like very intense program like the intensive dysphagia program for rehabilitation purpose. It's typically with a lower dose, less frequent, to aim at maintenance, not to aim at improvement. So what are some tools that we can use to help manage our dysphagia? Typically, there are two different categories. One is exercise, another one is strategies. So for exercises, we use them to target specific muscle groups or systems, such as our tongue, our jaw, our throat, our respiratory systems. And doing this, we usually follow our exercise principles, such as specific intensity, frequency, and motor learning process, just like you do other exercise at the gym with a personal trainer, or you do physical therapy after you have an injured arm or leg. So that's why we always tell our patients, you have to do this swallow or tongue exercise frequently, multiple times a day with certain sets and repetitions. It's because we wanted to achieve this outcome by following those exercise principles. If you only do it once a day, a couple repetitions, you may not achieve the best functional outcome. And then I'm going to talk about some different type of exercises. We have some low-tech exercises or traditional exercises, and then some high-tech with some specific devices and tools. For low-tech exercise or traditional exercises, you don't really need any devices, and I think a lot of our patient here, when you went through radiation, you probably did all these exercises with us. So like the effortful swallow, the tongue hold, Mendelsohn, head lift, and all the jaw, tongue, and range of motion exercises. Or sometimes you need to do some manual therapy, like massage, to lose the muscles. So now with the advanced technology that we have here, we have more high-tech options for patients to do exercise. And here you may have heard or used some of these specific exercise device, such as the tongue strengthening exercise device here, the IOP or the tongueometer. Some people may use this before. And also the expiratory muscle strength trainer here. And then we also have a very good tool with biofeedback That's the surface electromyography biofeedback devices. And then also the jaw range of motion devices, we have to open the mouth wider after surgery or radiation. And we have some, just earlier, the table, we have some samples of these devices there. And then also there's some newer techniques or tools that we use. This include the respiratory swallow coordination training and voluntary cough skills training, and also more biofeedback systems like the high resolution pharyngeal manometry. And also sometimes we use the FEAS, the flexible endoscopy exam of swallowing, as the feedback in the session to teach patients how to do certain exercise or maneuvers. And also, of course, the latest and greatest app that developed here by Stanford, our professor Heather Stammer, the HNC Virtual Coach app, which is a great app, has the nutrition and exercise information for patients with head and neck cancer. If you haven't downloaded it, I highly encourage you to go and check it out. And I'm sure that there would be more and more new tools that's going to come out in the near future, and then help us to swallow and exercise better. And then the other category I mentioned before as the management tool is compensatory strategies. So a very common strategy that I heard a lot of our patients use is the liquid wash with their solid food because of the dry mouth. So that's one of the strategies can help you to improve your swallowing experience better. But there's also some people will need to modify their bite size, like, they have to take smaller bites, or modify their food textures. They can't eat hard and they have to eat soft food. And sometimes will eat slower than a faster speed. So these strategies are typically helpful in some ways, but they're not exercise. So they don't help you to change the muscle function. But it's the best way is to combine specific strategies and exercise together to improve your swallowing experience. And again, I think to work with your speech pathologist to identify certain strategies and exercise for you, that's the best way to make the individualized management plan. And sometimes after cancer treatment and rehabilitation, patient will still have chronic dysphagia. Sometimes it can be very mild, and sometimes it can be very severe. And they have to learn to live with dysphagia. Living with dysphagia is not easy. As speech pathologists, we are the expert to treat dysphagia. But sometimes, or oftentimes, we only focus on one piece of the swallowing, which is their impairment or the symptoms. But we should know that living with dysphagia also involves the patient's environment, the patient's participation in activities, and also their personal factors. So here's a really good diagram that has the 4 pieces: the body function, environment, participation, and personal factor. And this is a framework of outcome measure developed by Dr. Kagan and colleagues. They are the expert in communication disorders after a stroke. So this is originally developed for the communication impairment in stroke patients. But my colleague, Jocelyn here, and we work together. We start to use this framework to help us to guide our dysphagia management in head and neck cancer. So this really helps us to look at the big pictures of the impact from dysphagia, not just the impairment of the body function. So as a patient, you also wanted to look at the whole picture. And so this highlight here, these are the body functions that you probably already know and then you're experiencing, and then you can do exercise to address it, and you can use your strategies to improve the experience. But sometimes that's not enough. You should also look at your participation. That just means work with your speech pathologist to see if you can identify certain locations or certain people or certain strategies that can help to support your eating and drinking to increase your social participation. Because eating is just not like one thing, just eating by yourself. You eat with people, you eat with family and friends. So participation is a very important factor to look at. And also look at the environment. See what kind of food texture, appropriate food texture are available to you across different social settings. And think about what alternatives you can use if you don't have appropriate food available in that setting. And then see how you can gain support from others in that social eating situation. Because, like I think Jess mentioned before, you have to educate them. They don't know you have swallowing problem because it's invisible. But if you let them know, and they will help you to make your environment more dysphagia friendly. And then we have to look at your personal factors, because different people has different personalities. If you have high anxiety or fear because of your swallowing disorders, you may consider working with social workers or psycho-oncology team for counseling. Sometimes meeting other survivors like today, or attending head neck cancer support groups or dysphagia support groups, you can get the support from each other, and you can reduce that fear and anxiety, and also reduce that social isolation. So there's a lot of factors to consider in managing dysphagia, not just the piece of impairment. Here's a quote that I really like. It pointed out the meaning we attach to eating and drinking and swallowing are connected to our most cherished activities and remind us of the intangibles of human existence, trust dependence, social worth, and love, and therefore must be integral to how we see ourselves as individuals and in relation to others. And that's why we should take dysphagia management seriously and also manage the whole person, not just the impairment itself. And here's just a quick recap of some important points that I mentioned today. Dysphagia is very common in head neck cancer, and it can happen before, during, or after the treatment. Appropriate and timely management of dysphagia is critical. And there are many different approaches and tools that are available to manage your dysphagia. And we should consider the whole person approach to dysphagia management, not just impairment focused. And last but not least, don't forget to see your friendly neighborhood speech-language pathologist if you want to manage your dysphagia. And then before I end, I just want to share this resource here. This is Heather mentioned that, our swallowing support group, Bay Area Swallowing Support Group, BASS. And me and my friend Claire, we started this year, and for people with dysphagia and their family members or caregivers. If you are interested, feel free to email us or go to our website, or we recently started our Instagram, so you can check it out more. Thank you so much.